So, good afternoon, everyone. This is Pooja, and I would like to welcome you all to a live session for reading discussion from Let's Update Language Academy. Let's just read for a few minutes for more people to join in, and then we'll begin. Good afternoon to all of you. Hello, Amal Kumar. Yes, good afternoon, Sini John, and hello, Lejuke Nair, and hello, Julin Manish, and good afternoon, Shanti Jimmy, and good afternoon, Biji Aju. Okay, so now, as you can see on the screen, I'm just going to give you an introduction of OET reading subtest that the basic instructions, okay, about OET reading subtest for those of you who are attempting or for the very first time, okay. So these information will be very useful to you. So that is the OET reading subtest. So that is basically divided into three parts. That is, you will be having three parts as part A, B, and C. That is how it is subdivided into, and you will have a total of 42 questions, and part A will consist of 20 questions, part B will consist of 6 questions, and part C will consist of 16 questions. Okay, so that is how it is divided into. And regarding the time duration, you will be allotted a total time of 60 minutes or 1 hour, and part A will be allotted 15 minutes, and part B and C together you will be allotted 45 minutes to complete. Okay, so today we are going to have a discussion about part C. Okay, part C module. Okay, so I just want to give you an introduction about part C before we go into the discussion. So that is basically part C. It assesses your ability to identify the detailed meaning and opinion in two different texts. Okay, each text consisting of about 800 words each. Okay, and the topics will be of interest to healthcare professionals. Okay, so it will be something related to healthcare. So so basically you will have two long text, okay, and followed by a set of questions. And so each long text will be followed by a set of 8 questions. So total you have 2 text followed by 16 questions. Okay. And the nature of the questions will be, they will be a 4 option multiple choice in nature. Okay, that means you will have 4 choices and you have to decide and choose the most appropriate answer among the 4 options. Okay. And so how about like how do you go about actually solving it or cracking it or approaching part C? So basically, first what you need to do is read the question first. Okay, so the conventional methods of comprehension passage reading, that might not work. You need not read the paragraph first and read the question and then again read the text to find out the answer. Okay, that might not work. So you can just read the question first, and then identify what information you need to find, and then when you read the paragraph, your intention should be to find the answer to the question you have just read. Okay, so you can do that. And then so now after reading the question, of course you need to read the paragraph, okay, in which there will be the answer to the question. So and then you need to read the answer options. Okay, you will be given 4 different choices of options and then you need to decide and choose the most appropriate answer. Okay, so that is how you go about uh, approaching part C, cracking part C. Okay, and usually the order is in such a way that the first question from part C, that will be from the first paragraph, second question from the second paragraph, and so on till the end. Okay, that is the usual pattern. Okay, in case you have a lot of paragraphs, in that um, situation you might not have a question from every single paragraph, if you, because you just have to solve 8 questions. In that situation you may not have a question from every single paragraph, but in other ways you will have. Okay, so it is usually in an order. Okay, so you need to keep that in mind and approach part C. Okay, so now we are going to have the reading discussion of part C. Okay, so now, okay, so as you can see on the screen, so this is a part C I have opened up for you. Okay, so for your convenience, I have structured the paragraphs and questions in such a way that each question will be under each paragraph, so that you can see the paragraph and the question and the options at the same time. I hope this is visible to you. So I can see a lot of you joining in. So yes, so you are free to comment your choice of answers in the comment box in Facebook once we begin the session. So as you can see on the screen, so the first question, that is the seventh question, okay, is according to the first paragraph. Okay, and so that is what they are asking. So in the very first paragraph, what do they actually intend to talk about this particular scenario? Okay, so you can read this paragraph, and I'll just give you a minute to read it. It's a very small paragraph, and then decide and choose the most appropriate answer, and then we'll discuss together. Okay, so let's just read the paragraph together. So that's heart failure patients have weakened hearts, but researchers say an experimental drug used for the first time in humans may repair heart cells and improve heart function. According to the results of a small phase 1 trial, a single intravenous infusion of the drug semaglutide was safe and at high doses improved heart function for at least 3 months. Okay, so question is according to the first paragraph, what do they intend to say about semaglutide? Okay, so the options are A is safe when used in high doses, B improves heart function indefinitely, C is undergoing trials, D is used in high doses. So you have two ways to go about solving this. Okay, either if it is directly specified, that is explicitly specified, then you can choose your answer very quickly. But then if it's not directly specified, then you can use the elimination method, in which you will get enough evidence to prove the other options wrong. Okay, so and then you can reach the correct answer. Okay, so these are the two methods usually used. So okay, so what do you think is the answer for this question? Whether it's A, B, C, or D, you can put in your choice of answers in the comment section in Facebook. Okay, so I can see answers coming up already. Ishani Gamlat has put in a C as the correct answer, and Priya Ammu has also responded with C. Julian Manish has responded with D. Amalraj Benoy with B. Sneha Jarin with B. Vijay Ajo with A. Okay, so we have a lot of options they're coming up. Okay, Renz Manuel put in A. Sini John and Sinu Eldos have both responded with option C. Okay, and so yes, the correct answer is indeed C. It is undergoing trial. Okay, so according to the first paragraph, okay, just look at this paragraph. Okay, what does it say? So according to the results of a small phase 1 trial, a single intravenous infusion of the drug, okay, so that was safe and at high doses improved heart function for at least. So what they are telling is it is undergoing trials. Okay, so that is something that is mentioned. Okay, so and they are talking about the results of the trial also. Okay, but if you go about looking at the other options, A is safe when used in high doses. Is that mentioned? What is mentioned in this? It the results of the trial indicated that it was safe at high doses. Okay, that is the results of the trial that they found. So it is mentioned in past tense. Okay, so that was something that they found as a result for that particular trial. Okay, and that was something done in the past. Okay, and it was found in the past. What is mentioned in option A is in present tense. That is safe when used in high doses. No, we cannot say that. That was just the finding of a phase 1 trial that was in the past. Okay, so you cannot tell that now it's safe and can be used in high doses. That cannot be safe. So thereby eliminating option A. Moving to option B. Improves heart function indefinitely. Okay, so they have not mentioned that. Okay, they have mentioned, what they have mentioned is it has improved heart function for at least 3 months. Okay, that's a very short duration. But what the option mentions is improves heart function indefinitely. Indefinitely in the sense that is for a very long period of time. Okay, that means you can't count. Okay, so it's like unlimited time or indefinitely. It's like a lot of like it is going to be continuous, okay, for an indefinite period of time. Okay, so that is something different from what is mentioned in the paragraph. In the paragraph they have just mentioned for a short duration, that is 3 months. And option D is used in high doses. What they have mentioned is the phase 1 trial was used at high doses. It was safe and at high doses improved heart function. Okay, so during the phase 1 trial, they tried this and they found that it was safe at high doses. But that was an again past tense. Okay, that was something that happened in the past during the trial. Okay. If they say now it's like used in high doses, then it's not correct. Okay, because it's still undergoing trials. Okay, and that is why we eliminated D also, and we coming to this answer, option C. Okay, so I hope that is clear to you, and moving to the next question and the paragraph. Question is, which of the following statement does Dr. Linehan make? Okay, so and then this is a paragraph, so you can read the paragraph. I'll give you a minute and then we'll discuss it. So let's read the paragraph. That's right now we have many therapies that we use for heart failure, and these patients were on all of those therapies had significant heart dysfunction, said lead researcher Dr. Daniel Linehan. He is a professor of medicine and director of Vanderbilt University's Heart Clinical Research Program in Nashville. Okay, so that is what the paragraph was about. And moving to the question, which is the following statement does Dr. Linehan make? Okay, so you need to find out which among these is the correct answer to this question. So what do you think is the answer? Okay, Amalraj Vinay has responded with A. Priya Ammu has responded with D. Tinkle Matthew has responded with A. Okay, option A, there is a P here. Okay, it's missing here, but actually there is a P. Okay, so don't eliminate A on the basis of that missing P. Yeah, so let's look at the options. Option A says patients who received semaglutide were on many other therapies. Option B, patients who received semaglutide suffered from heart failure. Then C, patients received it at the Vanderbilt University. And D, patients who received were not on any other therapies. Okay, again, yeah, I can see your answers coming up. Sini John has responded with A. Cherry Bellam has responded with A. Julian Manish has responded with A. The Renz manual has responded with A. Sinu Eldos has responded with A. Tingle Matthew has responded with A. Yeah. BG Ajo has responded with A. And so A is the correct answer. And why is it A? Because it's mentioned in the paragraph that right now we have many therapies we use for heart failure, and these patients were on all of those therapies. Okay. Okay. And this is a line that will take you to this answer. So now moving on to the next question. So that is question number 9. Which of the following therapies are not mentioned by Dr. Linehan? Okay, so I'll give you a minute to read the paragraph and come up with your choice of answer. Okay, so I can see your answers coming up already. Okay, so we'll read the paragraph. People with heart failure often take a combination of drugs, Linehan said. These include medications to lower blood pressure and diuretics to help remove excess fluid that builds up as a result of the heart's labored pumping ability. In addition, some people have implanted defibrillators or pacemakers. Even with all these options, the death rate among these patients is unacceptably high, Linehan said. So the question is, which of the following therapies are not mentioned by Dr. Lenihan? And the options are: A, therapy to decrease high blood pressure; B, diuretics to get rid of excess fluid; C, defibrillators and pacemakers; and D, therapy to increase low blood pressure. So basically, they are asking for something that is not mentioned. So whenever you see something like that, just highlight it or circle it or underline it. Okay, so that because you should not read it and come and end up choosing something that is mentioned over there. Okay, so you have to find something that is not mentioned. Okay, so just look at these options. Therapy to decrease high blood pressure, is that mentioned? Yes, that is mentioned. So that is mentioned over here. Include medications to lower blood pressure, that is mentioned. And diuretics, yes, that is mentioned. Okay, so that is also mentioned. Then defibrillators and pacemakers, that is also mentioned. Okay, so therapy to increase low blood pressure, that is that mentioned. No, that is not mentioned. Okay, so and that is why your correct answer is D. Okay, let me see. Just tell the names of whoever has answered for this question. Yes, I can see Priyamu has chosen B. Abraham Catherine has responded with D. The Renz Manuel has responded with D. Tinkle Matthew. Liji Raju, Cherry Bellums, Silji Martin, Cherry Bell, yeah. Julin Manish, Sinuel, those Amalraj Binoil, yeah. So most of you have responded with D, right? Leju Kenar, Biji Ejo, Tinu Thomas, Sinto Jos, Ligianish, Yamas all respond with D, and a few of you responded with another option. Okay, so now moving to the next question. Question number 10. So, what is heart failure? Okay, so, and here's a paragraph. I'll give you a minute to read it yourself. Your choice of answer. Okay, so we'll read it together. Heart failure, condition where the heart can't pump enough blood to meet the body's needs, is among the leading cause of death worldwide. A significant number of heart failure patients don't respond well to current treatments, particularly those patients whose left lower heart chamber, which pumps blood into the arteries, is weak, Lenihan said. So the question is, what is heart failure? And I can see your choice of answers coming up. So let's look at the options. A, a condition in which the lower heart chamber is weak. Option B, a condition in which the left lower chamber pumps blood into the arteries. C, a condition in which the blood pumped by the heart can't satisfy the body's requirements. And option D, a condition for which there is no treatment. Okay, so these are the options. So what do you think is the correct answer? So I can see a lot of answers coming up. Okay, so I'll just read out the answers anyway. Okay, so Ren's manual has responded with C. Tom Shaggy with B. Abraham Catherine, Biji Ajo, Twinkle Matthew has responded with C. Devika Devi with B. Tinu Thomas, Sini John, Liji Anish, Liji Raju, Amalraj Binoy, Sinu Eldo, Siji Martin, Sneha Jarin, Julian Manish, Amalraj Binoy, Grisha, Sam Sisley, Jisna Sijo, etc. have responded with C. Priyamu, Tom Shaji with D, and Sudhi Sabu, Nisha Benel with C. Okay, so let's look at the correct answer. The correct answer for this question is option C. Okay, a condition in which the blood pumped by the heart can't satisfy the body's requirements. And where do you think is the correct answer? It's in the beginning. Heart failure, a condition where um, just highlight that answer, a condition where the heart can't pump enough blood to meet the body's needs. So I hope that is clear to you. This is why your option correct answer is C. Exactly what is mentioned. Okay, so I don't think you need to eliminate the other options because it is something which is directly mentioned, explicitly mentioned over there. So moving to the next question, according to Dr. Lenihan. So that is the question. I'll give you a minute to read it and come up with your choice of answer. Okay, so let's read the paragraph now. So semaglutide acts as a growth factor for the heart, helping it repair itself following injury. Then Hand said specifically it binds to the HER2 and HER4 receptors on the surface of heart cells that are important for cellular repair and survival, he explained. Okay, so that was what the paragraph was about, and the question is according to Dr. Lenihan. So semaglutide. Okay, so what is a function or what does it do? Okay, that is what the question is about, and the options are A replaces receptors on the heart surface, B helps to enhance the size of the heart, C aids the heart's recovery process, and D has not been as effective as stem cells. Okay, what is mentioned in the paragraph? And I can see your choice of answers coming up. Okay, so Sini John has responded with C, Tintu Paulos and CG Martin with A, Sudhi Sabu and Dishani Gamlit with C, Sanu George, Grisha Priyamu with A, Julian Manish with C. So, Amalraj Binoy, Sinu Eldos, Cherry Bellum, Tinu Thomas, Sini John have responded with A, with C. So, let's look at the correct answer, and the correct answer for this question is option. Okay, so and the reason why it's C, because it's mentioned here. It acts as a growth factor for the heart, helping it repair itself following injury. Okay, so and that means that it aids the heart's recovery process. Okay, so helping it repair itself and helping in the recovery process means the same. Okay, so aids means to help. Okay, so recovery is the same as okay repairing it is being okay itself, right? So that is why your choice of answer should be C. Moving to the next question. Okay, so the question is, which of the following considerations is not part of the approval for a new drug? Okay, so they are asking about something that is not part of the approval. Okay, I'm just highlighting that. Okay, so please don't come up and come up with an answer of something that is part of the approval process. Okay, so I'll just give you a minute to read it and then we'll solve it. Okay, so I can see most of you coming up with your choice of answers. So let's just read it. So a phase one trial like this one is designed to see if a new drug is safe, not to test its effectiveness before semaglutide would be used to treat patients. It must prove its worth in a series of progressively larger and challenging trials and then be approved by the US Food and Drug Administration. The process can take several years. Based on these preliminary findings, larger trials are being planned. Enihan said, this drug, although still in an experimental phase, might be an important way to improve heart function in patients with heart failure, he said. Okay, so that was what the paragraph was about, and the question is, which of the following considerations not part of the approval for a new drug? Okay, approval by whom? It's by the US Food and Drug Administration. Okay, so that was what the reference is about. And then the options are A, safety, B, effectiveness, C, challenging trials, and D, planned trials. Okay, so which of these is not part of the approval process? Okay, so what do you think is the answer? I can see a lot of you responding. So Naveen Jacob Ambart has responded with D, Rishmi Srijesh with A, Sini John with B, Sudhi Sabu with D, Shani Gamlat with D, Nisha Binel with B, Liji Raju with B, Sudhi Sabu C, Julian Manish and Anumol Matthew, Amal Raj Binoy with B, Jinkle Matthew with C, Priyamu Amalraj Binoy, Silji Martin, Tinu Thomas with B, and Anmol Matthew also with B. Yes. So and then Krishnamni with has responded with B. Rishmi Srijesh with B. Okay. So we have a lot of answers coming up. Okay. So the correct answer for this question is option D, planned trial. And I'll tell you the reason why it's D also. So let's see which among these options are part of the approval process first, and then we'll come to something that is not part, okay, of the process. Okay, so here what they have mentioned here is it is designed to see if a new drug is safe. Okay, so the safety factor is there. Okay, so A option is something that is part of the approval process. And moving to the second one. Okay, so it's yeah, before it could be used to treat patients, it must prove it's okay. First, not just the effectiveness, they need to see, or it is designed in order to check whether it's safe. Okay, so that's why safety factor is there. Okay, the next sentence, before it could be used to treat patients, it must prove its worth in a series of progressively larger and challenging trials. It must prove its worth. What do you mean by proving its worth? That means it must prove that it's effective, it's working, right? Okay, so and that is why B is also mentioned here. And moving to option C, yes, that is also mentioned here, challenging trials. Okay, they have to prove their worth in a set of challenging trials. Okay, so that is also mentioned. Okay, so something that is not mentioned is planned trials. What they have mentioned about the trials that are being planned, okay, that is something completely different from the approval process of the US Food and Drug Administration. Okay, because the information with respect to the whatever is needed for the approval of by the US Food and Drug Administration, that information ends here. Okay, here I'll just highlight it in a different color. Okay, so just I have highlighted that part in green. Okay, so that ends here. Okay, so yeah, so it ends here. So and after that they are seeing that okay, the process can take several years, and based on these preliminary findings, larger trials are being planned. That's just what Lenihan said. Okay, so and that is nothing connected to the approval by the US Food and Drug Administration. That process ends here till where I have highlighted in green. Okay, so this is larger trials being planned is something that is with respect to something, and next sentence, that is with respect to something else. Okay, a new sentence. Okay, a new topic. Okay, so that's all. So that is not required for the approval of US Food and Drug Administration. Okay, approval by the US Food and Drug. Okay, so yes, but these three are required. It should be safe, it should prove its worth, that means it should prove that it's effective, and then of course they should prove it in a set of challenging trials. Okay, yeah, so moving to the next question, question number 13. Which of the following results were achieved with the drug? Okay. So I'll give you a minute to read it and then we'll solve it together. Okay, so let's read it together. So, for the study, Lenihan and his colleagues randomly assigned 40 patients to get an infusion of semaglutide or a placebo. Compared with patients who received a placebo, patients given a high dose of semaglutide had a sustained increase in the heart's ability to pump blood. The improvement lasted 90 days, with a maximum increase in heart function reached in 28 days, researchers found. The most common side effects were headache and nausea directly after receiving the drug. One patient who received the highest dose of semaglutide developed abnormal liver function, which cleared up over a 2-week period, Lenihan said. Okay, so that was what the paragraph was about, and the question is, which of the following results were achieved with semaglutide? Okay, so the options are: A, didn't produce any results; B, the effects of semaglutide were adverse; C, it improved the heart's ability to pump blood; and D, produced several side effects. So, what do you think is the answer for this question? Okay, so I can see your answers coming up. Sini John has responded with C. Reshmi, Srijesh, Nisha, Binil, Liji, Anish, Amalraj, Binoy, Abraham, Catherine, Sinu Eldo, Sanu George, Lorenz Manuel, Naveen Jacob Umbard, Siljan Martin, Sam Sisley, all of you, Sir Krishnan, all have responded with C. Okay, and so let's see if that is the correct answer. Okay, so now, yes, that is the correct answer. Option C, similar to improve the heart's ability to pump blood. Okay, so that is the correct answer. And let's see why it is C. Okay, so basically, they are asking about which of the following results were achieved with semaglutide. Okay, so what they have mentioned in the paragraph is patients given a high dose of it had a sustained increase. Can you see this line? I'll just highlight this line, the third line. Patients given a high dose of it had a sustained increase in the heart's ability to pump. Okay, so that is something mentioned over here. Okay, and that is why the correct answer should be C. Okay, and I think it's a direct answer, so I don't think you need to eliminate all the other options. But if there is time, you can do that also. But in this case, it's definitely mentioned. Okay, sustained increase. Okay, it had caused a sustained increase in the heart's ability to pump blood. Okay, so now moving on to the next question: which of the following is the most suitable title for the article? And I'll give you a minute to read it, and then we'll discuss it together. Okay, so now let's read it together. Despite the encouraging results of this first trial, a lot more testing will be needed before it can be considered a standard treatment for heart failure. So these findings need to be replicated in larger trials, and you have to be able to predict whether improved heart function from a drug will help people live longer and feel better, she noted. Okay, so the question is, which of the following is the most suitable title for the article? So, what do you think is the correct answer or the most appropriate answer? Okay. Okay, I can see a lot of you coming up with your answers. Priyamu with, has come up with D, Krishnan Onni with, and Rashmi Srijesh with B, Twinkle Matthew also with B. The Renz Manual has come up with option D. Okay, so let's look at this paragraph. Okay, what is mentioned in the paragraph? Okay, despite the encouraging results of the first trial, a lot more testing will be needed, okay, before it can be considered a standard treatment for heart failure. Okay, that is something that they have said. Okay, and then what they said is these findings need to be replicated in larger trials. Okay, and you have to be able to predict whether improved heart function from semaglutide will help people live longer and feel better. Okay, so what they have mentioned is, um, okay, despite the encouraging results of this first trial, that means the results of this first trial were encouraging. Okay, it was positive. Okay, but despite that, there will be a lot more testing that will be required before it could be actually considered a standard treatment for heart failure. Okay, that is something they said. Okay, so what they are saying is this drug, that is a new heart failure drug, okay, as per our options. Okay, so that the correct answer is actually option B. So a new heart failure drug shows promise. Shows promise means, okay, that means it has a bright future. Okay. It sure it you may get positive results. So that is what they mean by promise. It shows promise in first human trial. Okay. Okay. So that is something that they have mentioned here. Okay. So it's mentioned over here. Um, Though in the very first trial it showed encouraging results, and then it can be replicated in larger trials also, and you will be able to predict whether improved heart function will help people live longer and feel better. Okay, so that is mentioned explicitly in the paragraph. Okay, and which is why your answer B. And if you can definitely eliminate the other options. Okay, you cannot go with option A. It is not saying definitely that it will treat heart failure, because that would be wrong. It just shows promise. Okay, you cannot tell that it will treat. Okay, because it's still undergoing trials. Okay, so you cannot go with option A. And what about C? A new heart failure drug shows promise when tested on animals. That is not mentioned. Nothing about animals is mentioned. And moving to D, a promising new drug that treats heart failure as a bright future ahead. Again, there they have mentioned that treats heart failure. Again, you cannot say it will treat heart failure. Okay, it's still undergoing trials, and they have to still they are seeing whether how good it is, and they are trying to predict whether improved heart function will be there, and whether people will be able to live longer and feel better. Okay, so nothing is confirmed, so you cannot say that it will treat something unless it is finally proven. Okay, and with unless they say so. Okay, so and that is why your correct answer should be B. So I hope you have understood whatever we have discussed today, and I hope the session was useful to you. So it's time to wind up the session. So thank you for joining us, and take care and see you next week.